If you've been experiencing pain in your shoulder, it's time to take action. You might be wondering what you should be doing or if you're doing the right things to help you have a speedy recovery so you don't get stuck on a roller coaster of ups and downs and shoulder pain for months. Hi, my name is Dr. Joseph Rosie. I'm a licensed physical therapist and owner of Aligning Performance. We've been doing a video series on rotator cuff tendinopathy, and if you've been experiencing any sort of shoulder pain before, then chances are you know exactly how frustrating it can be. Now in this video, I want to share with you some of my experiences with treating rotator cuff tendinopathy, and I'm going to walk you through the healing process step by step. Now, I believe anyone currently suffering with rotator cuff tendinopathy should have a better understanding of what to do at each stage so you can take a more active role in your recovery. So, types of treatments for rotator cuff tendinopathy. Now, because tendinopathy means the tendon is considered to no longer be in a normal state, either it is thinned or thickened and is irritated, the best solution is to guide tissue healing towards that normal state. Now, if we're looking at a 30,000 foot view, that means either systematically increasing stress if you're closer to the stress shielded state, or decreasing stress if you're closer to the degenerative state. Now, if you've missed this, we talked more about this in detail in the first video of this series. So, whichever end of the spectrum you're on, the tendon is upset. So we will call this initially an acute or reactive tendonitis. This is where you start to feel pain or discomfort. Now, there is an inflammatory process going on, but with acute injuries, we want the body to have an inflammatory process. Chronic inflammation that goes on for a prolonged period of time, that's a really completely different conversation. So during this stage, you may be experiencing pain, swelling, or even feel warm to touch of the shoulder. You may also notice clicking or popping sensations when moving your shoulder as well. Now in this stage, we want to guide the healing process by allowing the cells brought in with inflammation to reach the injured tissue to repair it. We want to encourage blood flow to bring those cells in and then flush out the chemical irritants contributing to pain. This is why heat, massage, and light movements are advised in the early stage. Taking NSAIDs or using ice actually slows down the inflammatory process your body is already utilizing to try to heal the injured tissue. You can check out this video that goes into detail about what to do or avoid during an initial injury using the acronym PEACE. Now, after about 1 to 2 weeks, these symptoms start to subside. If you have followed the principles of PEACE in this video, you are likely now in this next stage, what is called subacute tendonitis. This stage can be most unique and most challenging to work with because people mistake the decrease in pain to correlate with a healed tendon. Now, that's not the case. Only about 50% of healing occurs in the first 2 weeks. It takes about 6 weeks for 80% of healing to occur. Now, once your pain and symptoms have reduced, this is actually the optimal time to focus on guiding that tendon back towards that normal state with guided exercise. Now, light movements or modalities aren't going to cut it anymore. Those were to help calm the tissues down, but now we need to introduce appropriate load to make lasting changes. And this is where you are challenged to find the sweet spot of loading enough to get the tendon stronger, but not loading too much or too quickly that you re-aggravate it. Now, in an optimal situation, you begin to appropriately reintroduce load and you continue on your path of healing. And we will get into the details of how to go about doing that. But what often happens is people jump back into what they were doing before right away, and they jump back themselves right back to that reactive state again, prolonging their overall healing time. This is when people get stuck on that roller coaster ride. Sometimes people also experience setbacks because they never actually allowed the acute stage to happen. They probably initially had some pain, took some anti-inflammatories, and thought it would go away, but it didn't. And they were never really able to decrease or modify their activity, whether it's because they had to continue to work, they had to continue to take care of kids, or continue to push through that pain or discomfort at the gym. Regardless, they didn't listen to their body and decrease their workload of the shoulders. The tissues are now getting more reactive, and this is kind of like your warning sign. Like when you're driving in the desert and it says last gas station for 100 miles, so you know you need to fuel up. This is kind of like that. It's your body's way of yelling at you to make sure that some of those modifications that we talked about in the acute stage, or else you're going to continue to progress down the spectrum of tendon disrepair. Now, this can have long-term effects on the tendon, and the tendon can start to degenerate. Essentially, what is happening is the body continues to lay down excessive tissue from chronic inflammation in an attempt to make the tendon stronger. This can have a paradoxical effect because people tend to be on a roller coaster in this stage. At times, they feel better, and at others, they feel as though they keep re injuring themselves, when in fact, they never really were healing at all. Ultimately, if people keep going down this path, it can result in a tear. So let's go back to the person who allowed themselves to heal and go through the acute stage the right way. Now, we want to start loading. We don't want to jump back into doing the same exercises or movement that are causing the irritation, but we do want to start loading and strengthening the shoulders. This may mean starting with some lower level exercises that are designed specifically to strengthen the rotator cuff and the surrounding shoulder stabilizers. Tendons respond very well to eccentric loads in this stage. It helps the collagen fibers in the tendons organize and repair in a parallel fashion as they should be in a healthy tendon. You then want to start working back towards those movements that created the irritation initially. I would start by making some modifications of the movement, maybe decrease the tempo or the range of motion or modify the mechanics in some way that there's not as much load. From here, you would continue to get stronger in a slow and controlled manner until you are able to slowly resume full activities that were causing the pain and discomfort in the first place. So, how long will rotator cuff tendinopathy take to heal? Well, 80% of tissue healing happens within 6 weeks, but the remaining 20% or 100% doesn't happen for about 12. These are also person-specific factors here, such as the integrity of the tissues before the injury, age, or having any other diagnosis such as diabetes that may slow this down. But for the average person to heal a tendon, we're looking really about that 12-week time frame. The exercises you do need to be done in order to progress and stress the tendon correctly until it is in a normal state. If you can't stress it enough, you simply can't do the same exercise with the same amount of sets and reps for 6 weeks and expect it to heal. You will have to continue to progress them, either by finding more challenging exercises, adding more stress, more sets, more reps, or a combination of all three. Now, the next video, I'm going to focus on specific exercise you can do with rotator cuff tendinopathy from the beginning of your injury to the end. So subscribe to the channel if you haven't already, and tap the bell so you don't miss the next video. Alright guys, thanks for watching. Please don't hesitate to leave a comment with any questions. I do go through them and answer them myself, and it gives me great ideas for videos to make in the future for you guys. So thanks again, and I'll see you in the next video.